Before Oncotype DX, the treatment decisions were influenced by many things. Patients hear the word cancer, or their family hears the word cancer, and they get very frightened and think that they have a potentially lethal disease and need treatment. As I said previously, in fact, most newly diagnosed prostate cancer that's low grade, and even some that's intermediate grade, Gleason's grade 7 we call that, is probably not destined to hurt anybody. And so up until now, the general pattern of care based on the patient's anxiety, the physician's anxiety, the lack of our ability to predict how the tumor might behave, most men have opted for treatment rather than for surveillance. And that decision was based on grade, stage of the tumor as assessed by digital rectal exam, and PSA levels. Now we have another tool that we've demonstrated adds additional clinical decision-making value beyond those three things and can allow men to make a more accurate decision and feel confident that that surveillance is a good choice for them. And in the occasional patient who might otherwise be a candidate or be interested in surveillance, recognize that they're not a good candidate for that because their tumor is more aggressive than the standard parameters indicate.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.